everyone, and welcome to today's program. Caregivers need love and support too. I'm Tori, and I'm the program manager for NKF serving Greater New York. We're so excited to be hosting this program tonight, and to everyone tuning in, thank you so much for joining us. Just a quick uh, just a couple of quick housekeeping reminders before we get started. We'd like to ask anyone who's joined from Zoom to please keep yourselves on mute. We also encourage all of you to ask questions and we'll answer them at the end. So if you're joining us from Zoom, feel free to ask your questions in the chat box. And if you're tuning in on Facebook, please ask your questions in the comments. We'll answer raised questions in the Q&A portion of today's presentation. So thank you again for being here. And today we're going to learn about a lot of topics related to caregiver burnout and CKD. So I'd like to introduce tonight's speaker, Rachel Cavallero. So Dr. Cavallero is a board certified clinical psychologist, and she specializes in solid organ transplantation and addiction treatment. She uses evidence-based approaches like cognitive behavioral therapy and biofeedback to address psychosocial concerns, conduct pre-transplant evaluations, and support patients and families through the challenges of transplantation. So I will now pass it off to Dr. Cavallero.
Thank you so much, Tori. I'm very excited to be here. And let's just jump right in. Yes, tonight's presentation is about caregivers. Caregivers need love too. I get to work with patients. I also have the joy of working with their families on particularly the inpatient side. And so the information that I'm going to be presenting today is a lot of what I've gotten feedback from and what would be helpful for other people to know when caregivers have told me in the past, like it would have been helpful to know. So tonight, what I'm actually going to start with is a little bit of education just to help you manage expectations, get a better understanding of what to expect as a caregiver and what that role looks like, and managing aftercare expectations, talking about some challenges in caregiving, how to preserve the patient-caregiver relationship, and self-care strategies. And I'll have some resources and supports for you at the end. All right, so understanding kidney transplantation, how do we get there? What happens is individuals struggle with chronic kidney disease and they get to the point of end-stage renal failure. Now, this could be related to diabetes, high blood pressure, polycystic kidney disease, autoimmune diseases, or some other conditions that lead to that point where your kidneys shut down. Then a nephrologist will recommend that an individual be evaluated for transplant. And so this is where really caregiving can start from a transplant perspective, although you may already be in a caregiving role supporting the person with this chronic medical condition. So the decision will be brought up to consider transplant as well as life on dialysis and any other treatment options that may be relevant to that person. And so as a caregiver, you want to be able to support the patient with identifying a transplant center and talking about the different types of therapies that are available. So broad overview of the kidney transplant process. It starts with an evaluation, right? So once you identify a transplant center, you will be evaluated, the patient will be evaluated. The team will ask that the primary caregiver attend all the visits, and this is where you'll meet the transplant nephrologist, surgeon, nurse coordinator, social worker, dietitian, pharmacist, financial counselor. The various transplant centers have different guidelines on what they're looking for. There isn't a universal standard. So you may choose to go to different transplant centers, and you may find that the process is different. So again, something to be aware of. Once you complete the evaluation, which is a full medical workup to determine is transplant a safe option for the patient, then you'll go get listed. We hear about the wait list all the time, right? And on average, people will wait approximately 5 years for a deceased donor, and much less time if they're able to get a living donor, depending on how they do that, if a loved one steps forward or if they submit their information and somebody feels like being an altruistic donor. And during that time, it's important that the patient get regular blood work to make sure that they're continuously safe and healthy enough for the transplant surgery. And again, this is where caregivers can help support the patient in this role, and also where caregivers may start to feel their own sort of stress as well, in this waiting process and not knowing when is it going to happen. And so it's important for caregivers to take care of themselves at this time as well. Identifying what's coming up for them, talking with your loved one, reaching out for supports to others at this time. So next comes the organ offer. So whenever that comes along for that individual, and the surgeon, the transplant surgeon, will go over different types of organ offers. Sometimes there's organs that are increased risk where they have hepatitis B or hepatitis C. If you consent to those types of organs, those conditions are treatable. You can get an organ faster. But again, it's an increased risk organ, but that doesn't mean that they're less functioning or lower quality. So you'll talk up with your surgeon about which types of organs you're willing to accept. This conversation can also elicit a lot of difficult emotions as well when thinking about a deceased donor, and what that entails, and that somebody's losing their life. Both caregivers and patients talk about the struggle with this idea as well. Next, once a organ is accepted, you will go to surgery. And this part tends to be very, very different between the patient and the caregiver. And the patient is preparing themselves for the surgery and life after transplant. And oftentimes the caregiver is struggling with thoughts of the worst happening and very worried about different complications or different scenarios that can come up, where the patient often is just focused on feeling better, right, as a result of the surgery. And sometimes that can lead to tension in the relationship, as the experiences are just so different for each of these individuals. And immediately after surgery, while you're still in the hospital, the caregiver, part of their role here is to meet with the team, hear updates, ask questions. The patient will be still recovering. They may be a little groggy, a little foggy. You'll receive education about wound care and medication management. While the patient is in the hospital, it is so important for caregivers to take care of yourself. There's a lot of stress, of course, leading up to this, and worry and concern. So once the surgery actually happens, I encourage you to go home and get some rest. You do not have to camp out at the hospital the entire time. And oftentimes when people do that, it is just so taxing and exhausting because you're really not able to take care of yourself at all. So you want to go home, rest, and recharge. Trust that the hospital staff will communicate with you if anything arises, and trust that they'll take care of your loved one. And that's what they're there for. If you have ongoing anxiety or concerns, this is where you can talk to the transplant behavioral health team, whether it's the social worker, psychologist, psychiatrist, depending on the center who they have available. You can also speak to your own friends and family, of course, about how you're feeling, or even the patient. This is where you guys can be a team together. And if your concerns continue and they're not being properly addressed, this is where it would be helpful to ask for additional help. So sometimes this is contacting the social worker and getting an outside referral for ongoing therapy at this time. Now, in the first 4 to 6 weeks after surgery, so once you leave the hospital, you return home, first 4 to 6 weeks, there's a lot of follow-up. And again, this is an area where I've heard from patients and their families that they just didn't realize how much was there. So just want to provide some education for you all to consider to manage your expectations on what this looks like. There is a lot of medical visits and lab work in the very beginning so that the transplant team can monitor how the kidney's doing and how the patient's doing. Also assess their general health. Are there any signs of rejection or infection? How is the body handling the medication and the changes that have been provided? And also, if there's any pain over the kidney area can sometimes be a sign of rejection. And a main role of caregiving includes transportation because patients aren't able to drive themselves in this kind of acute recovery phase. And your transplant team will provide more specific guidelines about that post-surgery. But generally speaking, 4 to 6 weeks, patients aren't allowed to drive themselves. And they have a lot of appointments. So this responsibility will then fall on the caregiver. The medication piece is so important. There are a lot of new medications the patient will be taking, and the caregiver is this is where they can help the patient take the medication as prescribed, understanding the use, the dose, the side effects, help them organize their pill box, order refills, and even monitor side effects. Sometimes the medications don't agree well with the person, and this is where the caregiver can communicate with the transplant team about what's going on and adjustments can be made. And some medications have very specific schedules. So related to the immunosuppressant medication, which has to be taken usually every 12 hours, if a dose is missed, this can lead to rejection, not just one dose, but if this happens repeatedly. And sometimes the medications, if they're not taken correctly, can also lead to acute kidney injury. So the medication piece is so important to pay attention to. And again, being a check for one another to make sure that the patient is taking it correctly. Another role of the caregiver is monitoring. So it's monitoring, again, how's the patient responding and healing? How's the wound healing? Assisting with the dressing changes, looking for signs of infection. And so those are some of the physical pieces. But then there's also the mental health piece and monitoring that. You know this person quite well. How are they handling this? Oftentimes, individuals who've never experienced depression or anxiety ever in their life will experience a transient episode of depression or anxiety on the post-transplant side. And why does that happen? Even when things are going well and the person is feeling better, what happens is they're not allowed to do very much. Their primary job is to rest and recover. And when they're recovering, they're not able to engage in things that they like to do. And they may be in pain or they may just feel very tired all the time. And because of that, they can't engage in enjoyable activities that they normally would. And as a result, what happens is oftentimes people's mood will start to drop as you're not able to do the things that you really want to, or you don't feel like you have the energy to do these things. Anxiety could also set in because of worries about the immunosuppression related to infection and those sorts of things. This is where, again, it's important to monitor these things and see how long they last. If it's just a couple of weeks, it may be very uncomfortable, but it passes. And if it extends beyond a couple of weeks, this is where it's important to get additional help. Another role or task of the caregiver is managing the household. Again, in this acute recovery phase, for this, helping with preparing meals and especially helping the patient stay hydrated. Now that you have a new kidney, you want to keep that kidney working, right? And letting it do what it's supposed to do. And it's so important to drink water and avoid caffeine and sugary beverages. The other piece of this is because the person had a major surgery, they shouldn't be lifting more than 10 pounds. So they may need assistance with other household chores or tasks at this time. There may be other particular things, like from an infection standpoint, patients shouldn't be changing cat litter boxes. And that's where they're going to need the caregiver to step in as well. Another piece is hygiene, and this will depend on the patient, depending on how old they are and how debilitated they are and how they're recovering on the post side. Some people feel quite well following their transplant surgery and may not need a caregiver assistance with hygiene, but others may need that, and that would be a key role for preventing infection. And a significant role of the caregiver as well as advocate, especially throughout this entire process, pre and post. Oftentimes what I'll see is patients shutting down when they're sitting in front of medical providers, sort of like a white coat syndrome, right? Or they'll even kind of yes their team, even when they're not really sure what they're saying. So this is where, as a caregiver, you can step in and be that person's voice, ask questions, clarify things if you really don't understand what the team is asking of you. I'd highly encourage you to make a list of questions before the visits to go in there to make sure that they're answered. If you find that your questions weren't answered during that visit, follow up with your nurse coordinator at the end, or the appropriate person, whether it might be your social worker or financial coordinator. Follow up with them. Your team is there to support you. And so as the caregiver, the team is taking care of the patient, but they're also there to help you take care of the patient. I love this quote: the negative screams at you, but the positive only whispers. And to me, it's very salient when I think about caregivers and the struggles that they face. Uh, Oftentimes people will get caught up in the frustrations of caregiving and focus on the things that are lost or the things that they're angry about, because they're so emotionally provoking. And sometimes what can happen is the person that you love and care for, the positive memories start to take a back seat, especially if caregiving happens for a prolonged period of time. It is so important to remember who that person is that you're caring for, particularly during the times of struggle. And sometimes you may just need to take a break or take time away. And again, this is where it's helpful to include other people in the care plan so that you can show up as, your best self for this individual and to feel better about what you're doing. So here are some challenges that come up related to caregiving. And one of the hardest things is thinking about advanced care planning. Nobody wants to think about that, thinking about the worst and what can happen if things don't go as expected, if there are life-threatening complications, if the person's health takes a turn for the worse before transplant. Having these difficult conversations beforehand, particularly as the caregiver, is so important so that it alleviates the stress or any guilt that might come up if you don't have these conversations. So if for some reason the person's health declines and they're intubated or they're unconscious and the doctor is asking you what to do next, you want to be able to convey the patient's wishes and beliefs and whatever it is that they want and honor their values, versus guessing, right? I think this is what they want. That puts so much stress on the caregiver, again, if these conversations aren't had beforehand. This is where I encourage you to speak with your social worker to discuss advanced directives. So power of attorney for healthcare, the medical power of attorney is deciding who can make medical decisions for the patient. Sometimes that's the caregiver, sometimes it's somebody else, so that you can just focus on caring for the person and somebody else is making the decisions depending on what your family system looks like. But again, helpful to have planned out beforehand. And a living will is a legal document used to document the patient's wishes for medical treatment. Living wills cover things like CPR, breathing tubes, tube feeding, antibiotic medication, pain management, dialysis, and even their own organ and tissue donation. And it's limited to the information everyone has at the time that it's written. And every agent and every healthcare provider must have a copy of this document. Again, it's a legal document, helpful to have on file so that it is very clear what the patient wants. Again, alleviates the stress from the caregiver. And thinking about post-surgery complications, some patients will experience setbacks or complications such as delayed graft function. Maybe this is the first time you're hearing this term. Delayed graft function is when the kidney is not up and running like we thought it would be initially. Sometimes it takes a little bit of time for it to really wake up and get working. And in that time, it is so emotionally taxing for both the patient and the caregiver. So this can result in longer hospital stays, additional procedures, and a return to dialysis, which can be incredibly disappointing. Rejection episodes, with thinking about organ rejection, it can happen at any time and sometimes occurs when the patient looks and feels well. This is why it's so important to follow up with your transplant team, attend those visits, get that lab work. Again, what happens is the team is going to look at the patient's levels from their blood work, and depending on what orders that they're having for the patient, and they're going to compare the patient's labs to themselves and see how they're trending over time. And that can give us insights as to what's going on with the individual. A big challenge is role changes, and it may seem small at first, but this happens twice. So it happens initially when the patient becomes very sick and they need help with caregiving, right? So then the caregiver is asked to step up. And sometimes this is when, especially if the patient is a primary breadwinner of the family, so to speak, and they're not able to do the things that they used to, the patient can then refuse help sometimes, or in their mind, what they're doing is they're trying not to burden you as the caregiver. But then this creates a disconnect, and the expectations and what it is that they need is not being clearly communicated, and the person may not be able to do the things that they need to for themselves. So there's the initial adjustment of kind of like the loss of independence related to the patient, and then the increased burden essentially on the caregiver to step up and do more, all the while still having to maintain everything else that they had going on in their life. Now, this happens again when the patient starts getting much healthier and more independent, which is ultimately what we want. We want the patient to return to a high level of independence. They may not return to the same level that they were prior to being sick, because transplant is a therapy. And the goal is to improve their quality of life, get them off dialysis. But this may, again, it's not necessarily a cure. So I want to make that clear. But the patient may, so they'll become more independent. And that's where the second role change happens. Because you may have adapted your family system to these new roles, and now they're changing again. And it's so important to have open communication related to this between the patient and the caregiver over who's taking over what things. And there are times where the patient may need caregiving, again, depending on if they get sick or something else happens, which can be very frustrating for the caregiver. Emotional and psychological support is paramount, as the patient and caregiver will be going through their kind of own challenges and how this looks for them. As a caregiver, you might feel sad, unhappy, or moody just from the stresses that come with caregiving. This may lead to depression. It's also normal to feel anxious sometimes, but again, if the anxiety is prolonged and you're worrying, about anything and kind of everything is what it feels like and it's persisting for weeks, this is where you may have a more clinical form of anxiety. You may also feel stress in your relationships with not only the patient, but with others, or you may feel like you don't have time for other relationships in your life, which leads to, again, increased emotional distress. Another point here related to your emotional health happens when you have expectations on how life is going to go. One of the hardest things that I think people struggle with related to this is when they get sick, if the person particularly is at a retirement age, I hear them say, you know, this is not how I planned my life to be. This is not what I saved up for. I didn't envision retiring would be me on dialysis and me waiting for a kidney, these sorts of things. Uh, as a caregiver, if it's a spouse or another loved one that you are very integrated with, you may also feel a loss of lifestyle, a loss of future plans or relationships as the patient's physical health changes. And again, this is something that's a little bit more invisible that can be harder for people to cope with. The other piece here is dietary and lifestyle changes. So on the pre-side of transplant, while somebody's in renal failure, they're encouraged to follow a renal diet, again, to reduce the burden on the organ. And on the post side, patients have to be very careful about what they're putting in their body, more so related to food sanitation versus phosphorus and magnesium and those sorts of things. This tends to be a big struggle, particularly around the holidays when you're going to other people's houses, right? And there's not as much control over how the food is prepared. This can also come up at restaurants, and some patients can feel really uncomfortable eating at a restaurant because they're worried about getting sick. And sometimes that can be very frustrating for caregivers, and it seems to create a divide between the two. And lifestyle changes for the individual on the post side. It's important that they reduce their sun exposure and being extra cautious during flu season as these individuals are immunocompromised. Again, this can feel like a barrier to caregivers from doing certain things that they want to, as the patient may not want to travel. Cruises can be very scary for people who are afraid of getting sick and being immunocompromised, or even going on a plane or being in crowded places. So this is something that needs to be discussed and come up with a plan on, again, how can you live your best life as a couple and get these needs met? Are these things that can be delayed, or, is there another way around this instead of putting yourself in a hazardous situation? And finances. Finances are an ongoing stress that people without any chronic illness experience quite regularly. And during this process with kidney disease and transplant, you as the caregiver may need to decrease your work hours. This may lead to less income. The patient may have to go on disability. You have less income from there. So both people may be making less money, making it much harder to maintain the same lifestyle. And along with that is having increased expenses from medical bills or medications and things like that. One strategy that you can implement is creating a budget or meeting with a financial planner to help ease the financial stress related to this, especially as things change. Also with transplant centers, you can meet the transplant financial coordinator or the social workers to talk about medical fundraising or other options to help alleviate the burden. Unfortunately, caregivers do not receive many financial incentives. In the United States, caregivers do not receive short-term disability or tax breaks. Sometimes Medicaid benefits offer paid caregiving. So this can differ by state. So this is something that you want to look at individually, again, state-based, and speak with your transplant financial planners about this. They can give you more guidance around that. And the patient-caregiver relationship, of course, this can be very strained, depending on the length of the caregiving. Communication is key, being open and honest. And that sounds simple. However, that might not be something that you've been doing very much. A lot of people don't like to talk about their feelings. A lot of people don't want to talk about feeling pain. They don't want to communicate that to their loved one because they don't want to burden them with that. As a caregiver, you may feel like, I can't tell them that I'm having a hard time because I need to take care of everything. I need to be strong. I need, to just suck it up and drive on. And so that could be very taxing on the caregiver and certainly lead to burnout. Also, when we have unspoken expectations, this can create resentments between both the patient and the caregiver, assuming things that will happen. I just assumed that you would do this because you're feeling better, or, there's no reason why you can't do this. Writing a list of what you can and can't do for one another, what the individual is going to do and what are they going to handle, as well as the caregivers, I'm willing to do these things. These are the things that I expect of you. Having explicit conversations will reduce a lot of tension and misunderstandings. There's a communication strategy that I really like to use. It's called Dear Man, which is a longer acronym, and it's a way to have difficult conversations. But the key is the first three letters, so D, E, and A. So you want to describe the situation, express how you feel about it, and ask for what you need. The ask is so important. Before you have these conversations, I always encourage people to think about what are you asking for first? And then you can frame the rest of this conversation. And you can make this short and sweet. You don't want to bring in past experiences or history or anything like that. You want to keep it very present, very focused. Here's what I need from you. It upsets me that you haven't been doing this, and this is the situation. Okay. So again, you can arrange this in a very short and sweet 2-sentence structure so that it doesn't have to bring up other issues that then you may get into a debate about. So be clear and direct. So caregivers may feel stressed from having to balance work, family, and caregiving. This can lead, of course, to overwhelm and burnout. Also can lead to a sense of physical exhaustion. You may find that you have low energy and limited sexual desire, which of course can impact, if this is a marital relationship, negatively impact your marital relationship, feeling disconnected. And you may also feel resentful towards your partner as you feel that you're the one having to always show up for them, and everything seems to revolve around their medical issues. And it may seem like you're taking a back seat. Again, this is where it's so important to encourage the patient to be more independent over time. So this eases the burden of caregiving. And it also helps with their own self-efficacy and reduces, again, the strain between you two. And seek outside help when you need to. Now, if this is a spousal relationship, this may look like couples therapy. But if not, it may just be doing individual therapy or enlisting the help of other people around you so that you don't have to take on everything all by yourself. And again, in spousal relationships, one thing you might want to discuss prior to transplant is a reproductive plan. If you're thinking about having children or you're worried about how transplant surgery will impact you in your ability to have children, talk about this beforehand and bringing it up to your transplant team. This is, again, another very challenging conversation to have, so important to have prior to this surgery. And following surgery, there will be a new normal for both of you. It's important to acknowledge that life after transplant will not be the same as it was before. You will both have grown and changed from this process in different ways. The patient may still need your help sometimes, and it's normal to feel stressed when this happens. Again, remember to ask for help when you need it to. I love this quote from Lucille Ball. Love yourself first, and everything else falls into line. You really have to love yourself to get anything done in the world. And I like that because it reminds us that we need to take care of ourselves, and essentially we are worth doing that. Um, Oftentimes, as caregivers, you're very selfless and you're so willing to do above and beyond for your loved one. But it's important to show up like that for yourself as well. If you've ever gotten on an airplane, you see this picture here, and they're talking about the oxygen masks, right? So if you lose cabin pressure, what's going to happen is the oxygen masks are going to drop down. And what do they tell you? They tell you that you need to take care of yourself. You need to put on your oxygen mask first. And why is that? Well, you can't help anybody around you if you're passed out. And the same goes with caregiving as a whole, and especially when it comes to burnout. You need to take care of yourself in order to take care of others. This is why self-care is not selfish, not at all. If anything, by engaging in self-care, it actually allows you to do more. And again, it's this reminder that you're also worth taking care of yourself as well. Lots of people hear the word burnout, but may not fully understand what that means. So what is burnout? Burnout is a state of being physically, mentally, emotionally exhausted for caring for the patient. And a telltale way of identifying that you're in a state of burnout is when you have kind of really intense negative feelings towards the person and you start to feel that you don't care as much as you used to, or just feeling like, whatever, I don't care about this anymore. I'm just over it, right? Once you get to that point, it normally means that you're burnt out and you really need to take some time to recharge, to step away from the situation because you've probably taken on too much, or you just don't have enough help in that situation. This can also lead to depression or, again, increased anxiety. So some things that you can do to reduce burnout are mindfulness, meditation, exercise, walking, getting outdoors, just changing your scenery, reading, listening to music, or any other activities that you previously enjoyed. Of course, sports or any winter activities, skiing, snowboarding, changing up your scenery, anything that brings you joy. Sometimes it's just important, again, to get away from the situation from a physical standpoint so that you can care for yourself. Something that can make burnout much worse is engaging in alcohol use or drug use. Because what happens is in the short term, it may alleviate some of those negative feelings that you have. So like with alcohol, it kind of numbs it. But the problem with that is it's also a depressant. So if you were feeling depressed to begin with and you drank the alcohol to get rid of the depression, you're going to be more depressed afterwards, right? And then you're kind of in this constant cycle. And certainly marijuana is a big topic. Lots of people are using it. When you start using it to manage anxiety, as it wears off, much like when alcohol metabolizes and wears off, you get depressed. When marijuana wears off and metabolizes, you then get anxious, right? And oftentimes for both of these things, there is an increased need then to use them. So you can get into a really vicious cycle of having to manage the way that you're feeling. So not very helpful. Again, don't go it alone. Remember to ask for help. This can be from family and friends to provide support just to you if you need that. or to help take over so that you can take the space you need to recharge. Um, again, enlisting very specific help, like, hey, can you pick up the groceries? This is what I need you to do. Can you pick up the kids from school, or can you run this errand? Hey, can you take the patient to this appointment? Like, I just can't do this today, and I really need a break. The more specific you can be, the better. Oftentimes people will ask you, hey, like, do you need any help with this? Especially if they can see that you're struggling. Trying to identify things that would be easier to delegate ahead of time will be very helpful, especially when you're in the thick of it, as you may have a hard time concentrating and you may feel irritable, or you may even shut down if you're getting to the point of burnout. And also using respite care. So respite care can be specialized staff like nurses coming in to handle medication management, things like that. Or again, enlisting family in that way in an informal sense to provide care to the patient, changing wound dressings or things like that if you're feeling very overwhelmed. So the next thing we need to talk about is self-compassion. And I think we don't always have the best understanding of what self-compassion is. So what is it? It's one piece of it is being mindful and recognizing when we're stressed or struggling, particularly without judgment or overreacting. Another component of it is self-kindness. So this is being supportive and understanding towards ourselves when we're having a hard time rather than being self-critical. And connectedness and remembering that everyone makes mistakes and experiences difficult times. It's not a free pass to accept unacceptable behavior. So that's a significant differentiation. Okay. What I'd like to do with you all now is actually invite you to participate in a self-compassion exercise. So if you're willing to participate, what I'd like you to do is sit up in your chair, feet flat on the ground. You can choose to close your eyes for this if that feels comfortable for you. And if not, that's okay. I would just encourage you to just cast your gaze softly downward. So now imagine yourself being in a caregiving context when you're caregiving for someone. And imagine you're there the best that you can. And allow yourself to experience some of the stress and difficulty of being a caregiver. Because being a caregiver is hard. Feeling overwhelmed, tired. Allow yourself to feel all of your feelings, even if they're the ones you think they shouldn't be there. Feelings like anger or irritation. Just let anything arise for you. Although we may seem superhuman at times, we are all still human. So I'm going to say some words of equanimity. I'd like you to please just remain open to these words. Everyone is on their own life journey. I'm not the cause of this person's suffering, nor is it within my power to make it go away. Even though I wish I could. Moments like these are difficult to bear, and yet I will try to help if I can. Let those words settle into you. Notice your breathing, particularly your in-breath. Noticing how the breath nourishes you, gives you oxygen, and as you breathe in, imagine breathing in compassion for yourself. You might imagine a white or golden healing light encompassing your body with each breath. And as you breathe in care and concern for your own care and struggle, giving yourself what you need in this moment. Perhaps that's strength, courage, peace, or simply compassion. Breathe in for yourself. And now focus on the person you're caring for, who is suffering in some way. Call the image to mind, what they are going through, and focus on the out breath. As you breathe out, imagine you breathe out compassion for the other, for their suffering and difficulty. You might imagine you feel their body, the golden healing light. Use the breath metaphorically to send well wishes so they have what they need. Acceptance, peace, kindness. And now I'll invite you to bring both together. So breathing in for yourself and out for your loved one. Alternating these breaths as you need it. In for me, out for your loved one. And feel free to adjust the ration if you need to. If you need more for you due to the stress and fatigue, 4 breaths for me and 1 for the other. 10 for me, 1 for them. Maybe 1 for me and 1 for them. Or whatever it is you need in this moment. If you feel your loved one needs more because of their suffering, you can breathe in more for them. Just remember to give yourself some as well. Remember, compassion is an endless ocean, and there is more than enough for you and the person you are caring for. And once more, remembering these words of wisdom. Everyone is on their own life journey. I'm not the cause of this person's suffering, nor is it within my power to make it go away, even though I wish I could. Moments like these are difficult to bear, and yet I will try to help if I can. If you had your eyes closed, I'd invite you to open them, bringing yourself back to the present moment, taking another breath if you need to. So I came across this Caregiver Bill of Rights, and I felt that it was important to include with this, and I hope these slides can be made available to you, as I think it's a really good reminder of, again, the need to take care of myself. This is not an act of selfishness, right? Some of these things can be really difficult to remember, but this Caregiver Bill of Rights helps remind us that boundaries are important. Giving all of ourselves all of the time is not healthy for ourselves or the ones that we love. All right. Now we can open it up to questions. I do have some questions that have been submitted, mostly about insurance. So should we start with those, or are there questions in the chat to answer?
Start with the ones that were submitted ahead of time.
Okay. So let's see. So insurance issues regarding seeing doctors, what procedures are covered, what kidney treatments are covered, etc. is very difficult. Okay. So with private insurances, most insurances require an authorization for procedures and treatment. So most importantly, the patient needs to meet his or her deductible before the plan starts making any payment, with the exception of copays. And the next one is what will private insurance cover? So most private insurances will cover an evaluation and transplant, but the patient will still need to meet their deductible and their maximum out of pocket. Once the maximum out of pocket has been met, then the plan will cover at 100%. What will Medicaid or Medicare cover? Medicaid will cover an evaluation and transplant at 100%. Medicare, along with Medicaid, will also cover a transplant at 100%. The evaluation goes under a cost report. You need a secondary insurance with Medicare, as Medicare alone only covers 80% of the cost. And then the last one I have here is how to sign up for Medicaid or Medicare. To sign up for Medicaid, you call Access Health. I have the number here. It's 855-805-4325. So that's Access Health, 855-805-4325. And they will screen you for Medicaid. To apply for Medicare, you have to be on dialysis, have received a kidney transplant, or have been on disability with Social Security for 2 years and have worked 40 quarters or 10 years paying towards Medicare. Okay. Those are all the ones I have.
Anybody have any final questions they want to drop into the chat? Right then. So thank you everyone for joining us today, and thank you to Rachel for making tonight possible. There will be a survey link going out to your email, so we'd love your feedback on the program. We appreciate your support and commitment to our National Kidney Foundation programs. Be sure to check out our website for any upcoming programs. And if there are any questions we missed today or any questions that come up, feel free to reach out to me, and I'll be sure to get you the answers that you are looking for. I will drop my email in the chat. And have a good night. Thank you, everybody.